Dolobene gel, it has anti-inflammatory, anti-edematous and local anesthetic action. Promotes the regeneration of connective tissue. The composition of the drug includes dexpanphenol. When applied topically, dexpanphenol is transformed in the skin into pantothenic acid, vitamin B. Indications: edema, bruising and inflammation of soft tissues, muscles, tendons, tendon sheaths, closed injuries, bruises, joint injuries with sprained ligaments and tendons, epicondylitis of the shoulder, tennis elbow, tendonitis, inflammation of the tendons, tendovaginitis, inflammation of the tendon sheaths, bursitis, inflammation of the mucous back of the joint, periarthritis of the shoulder joint, acute neuralgia. How to take, course of administration and dosage. Dolobene shall be applied as a surface layer of the skin over the affected area of the skin 2 to 4 times a day. When using the gel under the bandage, apply the gel and wait a few minutes for it to be absorbed by the skin and the isopropanol to evaporate. Then you can apply an airtight bandage. Dolobene can be used for iontophoresis. The drug is applied under the catheter. Dolobene as a contact gel can be used in ultrasound therapy. Phonophoresis. The active substances of the gel complement the therapeutic effect of ultrasonic waves. The duration of treatment depends on the severity of the symptoms and the severity of the disease. Contraindications: hypersensitivity to one of the components of the gel, active excipients, bronchial asthma, severe violations of the liver, kidneys, severe disorders of the cardiovascular system, pregnancy and lactation, age up to 5 years, open wounds of the site of application. Special instructions: the place of application of the gel must be free from other medicines, cosmetics, or any chemicals. Dolobene shall not be applied to the mucous membranes of the eyes, nose, mouth, open wounds or damaged areas of the skin due to the exposure, severe sunburn, postoperative scars. During treatment with the drug, the photosensitivity of the skin may increase. Therefore, during the period of its use, intense sunbathing and visit to the solarium shall be limited. Side effects: possible local skin reactions, redness, itching, burning sensation at the site of application of the gel, which usually disappear during further treatment. In rare cases, during the use of the drug, some patients may experience the smell of garlic from the mouth. The smell is caused by dimethyl sulfide, perhaps a change in taste sensation that disappear a few minutes after applying the gel. In isolated cases, allergic reactions of the immediate type, urticaria, quincus edema may occur. Extremely rarely when the drug is applied to large areas of the body, nausea, diarrhea, difficulty breathing, headache, chills may occur.